Here at the Master of Pediatrics program, as part of the South Beach Symposium in South Florida, a presentation was given and an update on the latest in acne treatment for children and adolescents. Now, Dr. Keri, you gave a talk where you talked about different recommendations for kids based on the age, and a lot of pediatric derms and pediatricians go by age when they're prescribing things. Can you give a quick recommendation for each type of acne?
Sure. We went through neonatal acne, infantile acne, mid-childhood acne, pre-adolescent acne, and then of course adolescent acne. For neonatal acne, the first thing to think about with neonatal acne is that you may not have to treat it. It is usually not a scarring process, and usually the baby will resolve and it will be fine. If you do want to treat, you can use some ketoconazole 2% cream twice a day. For infantile acne, it can be scarring, so if you see scarring in the children and you have comedones, blackheads, whiteheads, pustules, you may want to be a little bit aggressive to prevent the scarring at the young age, so consider treating in the infant age group. That would be less than 1. For kids that are between the age of 1 and 7 to maybe about 8 years, that's considered mid-childhood acne. For these kids, if they get acne, they really shouldn't. It's a time when androgen should be low in the baby or in the child. So you want to make sure that if you see acne in this age group from 1 to about 7 or 8, that you consider doing a hormonal workup for hyperandrogenism. In the next age group, which is from 8 to 12, people consider that pre-adolescent or preteen acne. This group is particularly difficult with adherence, so you want to do simple regimens, maybe a treatment that you use once a day, and you want to engage the patient, you want to listen to them during a visit. And then finally, with adolescent acne, I think with adolescent girls, we have to think about using oral contraceptives more in this age group, and that would be my pearls for each of the different age groups.
Okay. So Dr. Keri, you talked about the difference in prescribing acne medications between dermatologists and other types of physicians. Can you address that?
We reviewed a study that looked at practicing and prescribing habits from 1996 to 2005 between dermatologists and other primary care specialties. And I showed a nice table showing pediatricians usually prescribe benzoyl peroxide or a topical antibiotic at the top of their list. And our top 2 used medicines are topical retinoids. So we're prescribing differently, and if we're prescribing differently, there's a reason for that. Now it can be many-fold. It can be the way we're trained, it can be the drug company influence, but what I think it teaches me is that I have to tell primary care docs how to use topical retinoids because they are so important in helping with acne and preventing acne from getting worse.